8th Annual Age of Champions Health and Wellness Fair. And this afternoon, we have a presentation on the New Hampshire Commission on Aging. So the Age of Champions is brought to you by the Center on Aging and Community Living, and a number of us here are working together to make this piece happen. We wanted to let you know that captions are available, and that this slide is to show you where you can find closed captioning. At the bottom of your screen, your window, you would see something with a double C, and you can press on that, and there are options after selecting closed caption. Pick show subtitle, and the captions will appear on the bottom. If you're picking view full transcript, a running transcript of the captions will appear on the side. You can adjust caption size by selecting subtitle settings. Okay, next slide. This is a disclaimer to the effect that we just wanted you to be aware that of some information about what we're bringing to you. I'll just read this. This event may provide information related to exercise, fitness, diet, and nutrition, and other content that is intended for your personal use and information purposes only. You should consult with a physician before beginning any exercise, fitness, diet, or nutrition routine, especially if you are pregnant or have pre-existing health conditions. Nothing contained in the website should be considered as medical advice or diagnosis. Your use of the website is solely at your own risk. Next slide, please. And if you encounter any challenges accessing our content, as I just did, you can contact Bridget Drake at bridget.drake@unh.edu, and we'll put that in the chat. Someone already did. Thank you, Sam. We wanted to give a big thank you to our sponsors this year. It's been a great year trying to go virtual, and we appreciate American House, Bellamy and Watson Fields, the New Hampshire Association of Senior Centers, AARP, and the Alzheimer's Association, as well as the Active Retirement Association for their sponsorship. And finally, a shout out to our outreach partners. And if you've been at other workshops, you'll have seen some of them sharing the screen with you. But we've had, because of our virtual opportunity, we've been able to have partners in different parts of the state helping to bring people into the Age of Champions workshops. Those include American House in Keene, Easter Seals in Manchester, the Portsmouth Senior Center, and the Conway Public Library and Tamworth Cook Memorial Library. Thank you to those partners. This year, to mirror our 5-day virtual structure, we're in day 4 of our 5-day structure. Can't believe it. We will celebrate wellness through the model of 5 holistic wellness domains. Balancing these 5 dimensions contributes to wellness throughout the lifespan. Today's dimension is emotional, is the emotional dimension of wellness. This domain emphasizes self-awareness, compassion for self and others, mindfulness, optimism, and hopefulness. This is the feeling dimension of wellness. And we are getting to the end of our event. So tomorrow, Friday, April 23rd, will be our last day, and we'll end with the 5th dimension, spiritual wellness, and have live sessions throughout the day. In the morning, hospice and palliative care presentation, and in the afternoon, communication care needs, planning for caregiver emergencies, which I think so many of us can benefit from that advice and guidance, and a live facilitated work group from some UNH occupational therapy students. In these work groups, these sessions have been amazing all week. So encourage you to join.
Great, thanks, Jennifer. I do just want to mention too that we do have a chat feature with Zoom, and if you're not familiar with that, it's located at the bottom of the Zoom screen. It's a little box. You can open that up. You're welcome to put questions in there, and there will also be facilitated time later where you can come off mute. There's a mute button down there, and you can come off mute. And lastly, we are recording today's session. All of the content is recorded and on the event website. If you've missed something, go there and you can see some of our live sessions. And so again, thank you all for being here. And who is introducing Rebecca for us?
Well, you could, Laura.
Oh, okay. Hi, Rebecca. So we're really happy to have Rebecca Skye here. She is the Executive Director of the Commission on Aging, which was formed, I think, a year, almost 2 ago. And we're really pleased for her leadership and the leadership that the Commission has done to really think about how to become a more age-friendly New Hampshire, both in community and at the state level and in policies. So thanks, Rebecca, for coming, and take it away.
Okay, and I just want to check in. Jennifer, you haven't received the slides to share yourself yet, have you?
I can go and check.
Okay, because if they come up, it'll be prettier if you do it.
Okay. They're
perfect.
here, Rebecca. They're here.
Oh, then let's do that. Okay, I will stop my share then.
Yeah, I'm just gonna have to open them though, so you might want to just give us a little intro.
Okay,
Well,
so yes, I will dive into it then, because the first slide is just the header slide. So this is a pretty small group that's gathered here today, and when I looked at the initial registrations, I had seen that many of you have heard this presentation before. So rather than running through the same presentation very fast, I thought I'd actually take a little bit more time on each slide and allow you to ask questions and interject as we go. So I thought I'd first start by doing a thorough introduction of myself. Thank you, Laura, for initially introducing me. Prior to coming to work as the executive director for the State Commission on Aging on the very last day of January of last year, just before the pandemic blew up, I worked for 14 years for the Foundation for Healthy Communities on a variety of projects that sought to create change, either and often both at the societal level as well as at the systems level and institutional levels. And when I say institutional levels, what I mostly mean is hospitals, although several parts of the work worked in many sectors. I worked on a project that focused on increasing access to treatment for people with the opioid use disorders in New Hampshire hospitals. I worked on a project that sought to increase community offerings of evidence-based falls prevention programs. And I also worked to create the New Hampshire Health and Equity Partnership that sought to advance health equity for racial, ethnic, and linguistic minorities in New Hampshire. And prior to working for the foundation, I worked predominantly for a variety of nonprofits seeking to improve our communities. If you want to go to the next slide. So this slide is a picture of my family. I bring it up because we all age. We all have plenty of lived experience with aging. And here's a bit of mine. And I hope to, in the process, name some of the challenges I've seen in how age-friendly our society is and is not, and really the impact of ageism. The bottom left picture is a picture of my dad. He passed away this year. He had a fall in early November that led to surgery, which was followed by a hospital onset dementia. The #1 treatment for delirium in hospitals is to be around people you know, something that just was not possible due to COVID. Our overall response to COVID as a society has been very mixed. Yes, of course, we need to protect folks from exposure to virus, but we can't forget that isolation has impacts on physical health and well-being too. The picture above that is of my oldest brother. He's about 15 years older than me. Late in life, he went through a career change and struggles with finding employers willing to hire a person of his age. The next person over is my husband's aunt. She's one of the increasing number of older adults living alone. She has put off knee surgery for several years now for fear of managing the recovery. The next person on the top there is my father-in-law. He lives with Alzheimer's. Caregiving concerns around decision-making, navigating family issues, and cost of care have all, there's so many issues around caring for an older loved one. Cost of care is a big one. I had an interesting conversation earlier this week with a neighbor who was just struggling with the moral issues about qualifying her husband, who also has Alzheimer's, for Medicaid so that they could afford long-term care. My father-in-law was in an assisted living facility which closed as a result of COVID. And we have just a couple months ago, we're struggling to find a placement for him in a new facility that wouldn't imprison him. And I've been cautious about using that word, but I've just hear more and more stories that we've got to do something about the isolation in our communities and in long-term care. The next picture over is just a picture of a building, but it represents a colleague of mine's struggle to find placement for her father, who has lifelong alcohol use disorder issues. It's just been such a challenge for her, amongst everything else, to find a facility that would manage that and that issue of his in a way that worked for everyone. The bottom right is the picture of my mother-in-law. She lives more than 500 miles away from family, and she's been managing dialysis, and she's been managing dialysis through COVID. It's been amazing, but it's very much a struggle without family nearby. And the bottom picture is just a picture of my family, my siblings and their partners and their children. We're all in the process of aging. You can go to the next slide. We all want to live well and live in communities that support us all, support all of us to live well. Yet, according to the March World Health Organization report on ageism, every second person in the world is believed to hold ageist attitudes, which leads to poor physical and mental health and reduced quality of life for older persons, costing all of us billions of dollars each year. The double burden of this is that across the world, the average age of our population is older than it was in the past, and this trend is ongoing. That's not something I need to necessarily tell this audience. To reap the societal benefit of people living longer, often referred to as the longevity dividend, we need an aging attitude adjustment. Older age, like any other time of life, involves both challenges and opportunities. The future really is a time for improvement. We are all better off by being inclusive. With this in mind, aging advocates, led by the Alliance for Healthy Aging, sought to create the New Hampshire State Commission on Aging in 2019. You can go to the next slide. So the commission is a new entity. It was first convened in the fall of 2019. As I mentioned, I was hired on the last day of January, and it's really been a whirlwind ever since. Next slide. So the makeup of the commission, it has 26 members. There's 1 state senator. There's 2 state representatives. There's 13 community members from all 10 counties and representation from 8 state agencies written into the statute that created the commission. The 13 community members are appointed by the governor. They each have a 2-year term and are able to be renewed in that appointment 1 additional time from the first time that they're appointed. So they're eligible to serve 4 years. At this point in time, as we need to replace commission members, We do have a task force, a subcommittee of the commission that is looks at what the needs are, what kind of expertise we are seeking around the table, what sort of community representation, and makes a recommendation to the governor's office. The governor's office is welcome to do what it likes, but at this point in time, that's how folks are being appointed to the commission. That's not to say that the public can't participate in a variety of other ways with the work of the commission. As I get further on in the presentation, I'll talk a little bit more about the task force of the commission, and that's certainly a place where voices can be heard. We also hope to be doing more and listening more out in communities. Next slide. So this next slide outlines the duties that are listed in the RSA for the commission. It's really the charge of the commission. You'll see by doing a quick scan of it, it tells us where we can have influence. Simply put, our charge is to advise the governor and the general court on policy and planning related to aging. But this set of duties doesn't tell us which topic areas we really should be focusing our attention. So you can go to the next slide. So last spring, about this time, we initiated a strategic planning process that lasted over the summer months. We dialogued, we did research into what data exists at the time, did a landscape of the data, and we created an agenda of common goals and strategy. If you would like to go to the next slide. At the end of the summer, we had developed this strategic map for the commission. This is available on the web pages that you can find. I'll have a link at the end of this presentation that leads to that'll give the directions to the web pages. But the left side has our vision and mission that we worked on, the right side our values, and then we developed 3 very broad strategic priorities that we have since worked on in the form via task force to further develop. You can go to the next slide. I'm going to go through each of these pieces in one by one. So for our vision is for all people to have the opportunity to thrive and be valued while growing older in New Hampshire. And our mission is to be a catalyst for change that values, serves, and celebrates people as they grow older. Next slide. So our values, what I would like to bring forward here, so you can read through them. We did spend a bit of time on these because we really as a new initiative, we really needed something to guide help create our culture and guide the way we do our work. And so this just wasn't a random exercise as far as, let's throw something down that sounds good. We really worked together to think about what we wanted to be, what were our aspirations. And you will see here that there's a good bit of talk about collaboration and expertise. With this group, I see that there's a number of professionals who've worked in the field of aging for a long period of time. We know that around the commission table, we don't have all the expertise we need. We really want to utilize the wealth of knowledge and skills that are available across the state. So we want to hear from you. And then the bottom one I also would love to point out is this engagement. We really, from the very beginning, it was very loud amongst commission members that we needed to address ageism in our society in New Hampshire. And one of the best ways to do that is to leverage the talents and energy of older people in New Hampshire to help create the future we want to see. Next slide. So over the next, so we developed 3 strategic priorities as our starting point. As a new entity, any entity goes through developmental stages, and we are at the very beginning. We are newborns to toddlers at this point, as far as an organization is concerned. So we developed these very broad strategic priorities to focus on over the next 3 years. we are doing a significant amount of learning in each of these topic areas, and we expect more refined plans to come. So we hope to develop and advance strategies to improve people's ability to age in the community of their choice. We want to catalyze New Hampshire towards being an age-friendly state. Engaged leaders regarding the emerging needs of older adults during the COVID-19 pandemic. We were developing this strategic plan just in the early months of experiencing this pandemic. And we knew from the get-go, we saw how some of the policy that was being developed was coming was being influenced by the implicit bias that so much of we all share around age and ageist ideas. And then finally, we knew we needed to do more work to develop the commission infrastructure to support operational success. Next slide. So as the result, as we wrapped up the strategic planning, we decided that we needed a task force to address each of these different areas, and that these task force would be really the incubation places where we would dive deep and learn about topics and bring forward ideas for the whole commission to consider at our monthly meetings. These task force, the meetings are announced on our web pages. Anybody is welcome to join them. They are small groups at this point in time, and so there's a great opportunity for contributing to the process by coming to these task force meetings. So the Aging and Community of Choice Task Force, we started with our broad 3-year objective. We developed a 1-year objective, and then we have started developed a list of activities that we are that is in our work plan. Those activities are ever changing as we learn new things. Next slide. Age-friendly state task force. Goal is to catalyze New Hampshire towards being an age-friendly state. We've spent a good part of this fall and winter months meeting with leadership of age-friendly community initiatives to learn what supports from a state level would be beneficial to their goals. And we've had various state agencies already come to the State Commission to discuss how they incorporate the impact of aging in their strategic planning. There's certainly so much more work to be done in both those areas. Next slide. COVID-19 Emerging Issues Task Force. So there's so much that could be addressed by this task force. We decided early on to really pick 3 broad areas to focus our energy. Right off the bat, ageism, addressing the perceptions regarding older adults, societal behaviors, and economic opportunities during the pandemic. We early on sent a letter to the governor's reopening task force, speaking to using a lot of the language from the Frameworks Institute, for those of you who are familiar with the Frameworks Institute, to urge the reopening task force to use the science of public health in making their reopening guidance, so that to keep all of us safe, but yet to be conscious of not, that we all need to participate in our society and in our economy to have thriving communities and have a thriving economy. Social isolation. Research and review strategies to alleviate social isolation during this pandemic, such as broadband access, training on the use of technology. We've looked at it specifically in long-term care facilities. We've wrote a white paper that was we provided to DHHS Public Health around the visitation guidance in long-term care facilities. We probably are going to revisit that issue as summer approaches. The state did back in September change their visitation guidance to long-term care facilities, but there's still so many stories that the Office of Long-Term Care Ombudsman hears every day from families who are struggling to connect with their loved ones in long-term care. And then the last one is about the long-term care system, and that we really want to we're not yet at the point of doing an after action report, but we've got to begin at some point in time looking forward about how we need to redesign our long-term care system, facilities and systems to be better positioned to be resilient in situations like this pandemic. You can go to the next slide now. Finally, the Operational Infrastructure Task Force. You know, the RSA only laid out so much, so that the task force, this particular task force, sort of oversees the work of the other task force to some degree, develops the agenda for our commission meetings. We've done work clarifying terms, defining roles and expectations of members of the commission, and have navigated a way for advising the legislature and governor on current legislation and recommendations for future public policy. This is the group that is also following what is happening at the legislature, because there's so much change that happens there at every moment in time. So trying to be attentive to where our voice can be of value. Next slide. So one of the ways in which we do advise the governor and the legislature that is written into the RSA is that we have to submit an annual report as of November 1st of each year. We did do one from this past year, published November 2020. Here's a brief summary of the recommendations that were made in the annual report. You'll see that they're very broad. They were the result of the topics of the various commission meetings. I do expect future annual reports to become more concrete and drill down to be a bit more nuanced in the recommendations that come forward. Next slide. Want to say that the annual report and the executive summary are available on the web pages of the commission. Please do take a moment to check them out. And by all of us echoing the content of them, we hope that to be able to bring forward the future that we all want to see. Next slide. And finally, I have here my contact information. I can put that also into the chat. And at this point, I really want to open up to questions and comments. What I'd love to hear from folks is this commission is is of the state government and is meant to be for the people, by the people, et cetera, all of that. And so I'd really love to hear what you think the commission should be looking at and addressing and studying and making recommendations around. So I don't know how we unmute everybody. Can we do that so that we can
They can unmute themselves. It looks like.
Okay,
Yeah.
I have to change my view so that I can see everybody. There we go.
So I do have a question while people are maybe formulating what you thought of. I noticed you referred to, an age-friendly state, and I'm wondering if you could maybe define that a little bit more of what that means and how the commission might be taking that on.
Okay, so an age-friendly state, our task force this year that took on this issue spent and is still spending time studying what does this mean, and we've looked at a variety of models. We've heard from folks that have been working on this across the state, folks from North Conway region, from the Southern Regional New Hampshire Planning Commission. We've heard about not only those that are following the ARP model, but we've also heard from people who are working on village projects, Seacoast Village Project, for instance, just to learn what's going on and what are people doing and what matters. And so I think that that task force right now is struggling on two fronts. It wants to figure out ways that it can support communities to do this work, this very important work. Is there changes to state policy that can happen? The fact that towns write master plans based on state guidance, can that state guidance talk about what it means to be age friendly, and ask towns to consider that? So those are some of the policy considerations that this task force is looking to do. But it's also been charged to look at state agencies and see what we can do to help out state agencies to be more age friendly, and that we still have to do a lot more investigation on that matter. You know, all state agencies have been stressed. All organizations across the state have been very stressed with the pandemic. So it's felt like while there's never more important time to go to state agencies and ask them to do this, it has also felt like this is not the time to go and press hard on these issues around education and strategic planning for the future. I mean, this last year, the governor, in creating his budget, asked all state agencies to do a 20% cut to their budgets. Yeah. There's no quick answer to that, but it's something that we are working on and would love input from others.
There is a comment in chat, Rebecca, from Linda. And Linda, I don't know if you're welcome to come off mute and share your comment.
Okay.
So first, we'll just read it if Linda's not coming off. So she
right.
said
So
that.
New Hampshire. So Linda had said New Hampshire had a higher than other states COVID infections in nursing homes. The commission should help investigate the issues and try to help be a loud voice to develop and implement improvements. Agree that we should be a loud voice to help develop and implement improvements. And that emerging issues groups is talking about how we can do that effectively. I know that there was some concern about how the media was reporting infection rates in nursing homes and why the rate in New Hampshire was so much higher. There could be a lot of drivers to that, including the average age in our nursing homes compared to other states. But that is something that has come up in conversation at that group. That group has also looked at vaccination and has tried to encourage reporting on data on vaccination rates based on age, and that has now happened. And we can now begin to look at that. And we've also encouraged the outreach to homebound individuals and being creative in how that's done and how the word gets out for people to gain access to vaccinations. One thing that is true about New Hampshire nursing homes too, in comparison, while those infection rates were reported high, we've also had one of the highest vaccination rates in nursing homes, both staff and residents, in comparison to across other states across the country.
Rebecca, this is Jennifer. You've talked a bit about how the commission really can serve the role of being a megaphone for key issues that impact older people. And you've talked about how the Commission on Aging has that direct line to legislators and the governor. I'm wondering if you could elaborate a little bit more on that community engagement piece and how you might be using that to inform your knowledge of what those key issues are that you're taking up to the legislators and the governor.
Certainly. So I see that as a bit twofold. So directly, how can the commission do that? The commission has a staff of exactly one, which is me, to help them realize their vision of everything that they would like to achieve. The fact that there are commission members from all 10 counties in New Hampshire, part of their charge in setting out the expectations for commission members is that they be connected to their communities and that they be asking and what are the issues in the communities of their county. But secondly, as you notice, that one of our values was collaboration. We really do hope to collaborate with organizations that are extremely effective in community engagement, like the Alliance for Healthy Aging, and other community partners to hear what's coming up for them. We are trying to have commission members sit at various tables around the state. There's more work to be done there as well. Those are some of our key ways of doing that. So how's that? And you know, the other thing is that my phone is always on, and my email. I'm happy to respond to anybody who would like to directly connect with me about any particular issue.
I have sort of a follow-up on that. I think what your answer was great. I did.
Yeah.
And I wondered, I love the fact that this idea of engagement is really so important in terms of the commission. And are there, so I think this forum, while it might not seem like the typical forum, like in terms of policymakers, is actually a great opportunity to reach a broader audience, because I know it's so new. A lot of people don't know what the commission is yet. So is there a sort of a specific plan around branding or making the general public more aware?
So yeah, I want to thank the Age of Champions for inviting me to be able to come here and talk. I've been seeking every opportunity to talk about the commission. It's been very, we've all experienced the awkwardness of COVID and how hard it is to be out in community and to be connected and networked. But my hope is as we get this COVID under control, that we'll be able to have commission members feel more comfortable going out and being in public. All of us going out and being more comfortable being in public. As far as specific branding, we're still working on that. That's the answer to that. But we definitely, we want to hear, absolutely want to hear what is important to, what is important to you, what is going on in your community that concerns you, what is going on in your life that is concerning you. That's critically important to being able to be that megaphone. It is a new entity, and we do struggle with people understanding how we can be helpful. So give us a shot.
I just put in the chat that we might, is there, maybe it was in the PowerPoint and I missed it, but a list of the commissioners from each county. Can you share that with us?
It's on our web pages. Happy to share with you. Do have to make a couple updates to our web pages, but I don't have a simple list that I can share in the chat, and it wasn't on the slides. But
no, that's okay. I'm sorry, I didn't mean to.
Oh no, that's
put
fine.
you on the spot like that. No, that would be great to have the list if we could share. Thank you.
Polly Campion is our chair. She was a state legislator who helped champion the bill that became the Commission on Aging. She's amazing and is always has a welcoming ear. As far as realizing the vision of the commission, it's very easy in a position like this for the executive director to be the lead. I really strive to follow the lead of the commission and help them find their vision. And that is one of the ways that this becomes a megaphone for multiple voices.
Rebecca, I have a question, and there may not be an answer yet because you're still so new as an entity. But what is the process of the commission formalizing a recommendation, and how does it get to the governor?
So there's multiple pathways. Bringing an issue forward to a task force is a wonderful way for there to be some initial conversation around a particular topic, for some incubation of an idea, and for a proposal to develop a proposal. Then is brought to the full commission, and then the full commission ideally would vote on that particular proposal and move forward on it. Oftentimes, that is for a specific action. But as far as the areas that the commission is investigating, that is often creates opportunity for that, for creating change at the small p level. People talk about big P policy being like bills and legislation, and small p being, the rules that govern how an entity within state government works. And so we often use those conversations that happen at the task force and at the full commission meetings as a basis for going and continuing to dialogue with decision makers on particular issues.
Rebecca, thank you so much for your presentation. That was lovely. And for sharing about your family too. I was very touched by that. And I guess I was just kind of wondering, for myself, right? Like how can I help, right? Like, I'm part of UNHCACL, but, I'm also thinking about my parents who might be interested in something like this. How can I, what do you need from us, kind of thing? How can we be helpful to you in the commission?
So definitely over the past year, I've received phone calls from families concerned about a variety of issues, numerous phone calls around vaccinations, which help to influence our conversations at the Emerging Issues Task Force and the development of our we called it a working paper because the ground was changing so rapidly around how the rollout of vaccinations. But it really helped with having conversations with some of the decision makers within public health about how that was happening. So hearing what's going on from you for you and your family is important, and you can certainly come in and tap into any of our task force meetings, or call directly either a commission member or myself to have a conversation about what's happening, and also to help you figure out what's happening, because that's the other piece of it, is that sometimes we don't know why a particular thing is happening or what's really going on. What's the bigger systems influence on what's going on in your individual life? So the stories are important. They help us they alone cannot help create the system change that we all seek, but they are an important part and component in being able to move public will and decision makers' wills on those issues.
Rebecca, I'm wondering if there's a few champions that you could name already in the the legislature that have really come alongside the commission, both and if they're just thinking about ways that efforts to make sure we're voicing to our own personal legislators what our wishes and needs are around policies.
Thank you for saying that. That's another great way, is that everybody can be part of the megaphone. So taking the issues that are being brought forward and figuring out how you can communicate to your own legislature about a particular issue. So as far as champions within the legislature, it's been a challenging year with everything remote to really develop those relationships. We do have our from the Senate is Ruth Ward is our representative to the commission, and on the from the House of Representatives we have Jim McKay, who's been he's such a he's a longtime advocate and a new Zoom user. So it's great. And we also have Charlie McMahon, who joined us for his first commission meeting earlier this week. And I think he's going to be a very strong ally of the commission. As far as developing additional relationships within the legislature, it's just been a challenging year to really figure those things out. We actually do rely quite a bit on the table created by the Alliance for Healthy Aging to learn about what other advocates in the state, what are their concerns. And I think that if you are a person who is interested in contacting your legislature or participating in the legislative process, providing testimony, etc., I'd be more than happy to hear from you to help you figure out how to take that next step. Wow, I was a little concerned about being able to fill the hour. It disappeared.
Yes, we're almost at the end of that.
I think Nancy might have a question.
Yeah,
Nancy, do you have a
Nancy might have-
question or comment?
I was just wondering, how are you making connection with healthy community dwelling older people? How is their voice getting into the mix? Is it primarily through the commissioners that represent their counties?
Yes, and it's through avenues like this. And some communities have their own committees on aging, and participating in those conversations. Not putting myself, inviting myself, but asking to be invited to those venues. There's Stratford County is engaging on an age-friendly initiative and are doing community listening sessions. A commission member was invited to one and asked if I would come too as well. And so, in that way, hearing about what's taking advantage of other people's engagement, opportunities for engagement created by others has been wonderful so far. I've really appreciated that.
It's a lot of work you're doing. Thank you.
There's a lot of work being done by a lot of people in the state. It's really inspiring to hear the work of others and to really hope to just be a champion of it.
Does anyone else have a question, a last question maybe? Or it sounds, Rebecca, like you are more than willing to have people reach out to you.
Absolutely. Absolutely.
And I think you put your email in the chat here.
And I don't know that I put
But
my phone,
so you're willing to have that shared. Good
oh
job.
yeah.
So I think we are nearing the end. Laura, did you want to wrap up for today, or?
Yeah, I was just looking for, sorry, I was trying to find a resource for the chat over here, because the Stratford County Age Friendly is actually called Chat, C-H-A-T.
Oh, that's so funny.
So I was like, maybe I can put something in, because I know even though we're statewide, there are several folks on the Seacoast right now. So this has been great. I really appreciate, Rebecca, you coming and talking and sharing about the Commission on Aging. And it's really great to see. I almost was going to ask a question about, the intersection with the New Hampshire Public Health Association, because I don't know if you all realize it, but we're in the midst of two past presidents on our screen here of the New Hampshire Public Health Association, between Marie Mulroy and Rebecca Skye. So grateful for
almost those. Three. We almost had you, Laura.
No. So really thankful for the conversation, and there are many ways. If you go back to the Age of Champions, there's so much age friendly, Age of Champions event page. There's some connections to the Commission on Aging. There's also connections to the Alliance for Healthy Aging and those intersections there. And I'm really excited to also say that in our presence is one of our presenters for tomorrow morning at 10 a.m. Nancy is part of that panel, really talking about palliative care and hospice and end of life. And really that thought of that's not the last 2 weeks, right? That is about conversations now. It is about, as our tagline for this is, it's never too soon to age well. It's never too soon to have these conversations, personally with our family and others. So really looking forward to that. It's at 10 a.m. And then tomorrow afternoon, we have 2 more sessions, another one around, as Jennifer said, around a community living guide. And again, those conversations that we need to have about what matters to us. And how do we do that? Not only there's some great things happening within the medical side about what matters to us, and that movement about age-friendly health systems, but there's also what matters to us on the social side. What matters to us about staying in our communities, or how can we stay in those? What are the questions we need to be, again, thinking and talking about? And then finally, we wrap up. If you haven't been to one of the sessions with our occupational therapy students, they've been 3 days live. It'll be live tomorrow. They're just wonderful, really engaging. And, I think the talk about, we're all in this together and learning from them and them learning from us. It's one of those great opportunities. If you come to that 2 p.m. session, we'll be having the occupational therapy students, and then of course, wrapping up our week. So thank you all so much. Thank you, Rebecca, for all the work you've been doing to corral the commission for so long, and appreciate this whole team and everybody for our technical difficulties and just hanging in with us, because it was worth it to talk about the Commission on Aging. Thank you all.